The second wave continues to hammer India. In the last 24 hours, India has reported more than 400,000 cases for a third time. More than 414,000 people tested positive in one day. The highest single-day figure ever for India. That takes total cases since last year to 21 million. India has more than 3.6 million active cases, the second highest in the world. The highest is still in the US. They have more than 6 million people who are positive right now, the active cases. And nearly 4,000 deaths in the last 24 hours in India. Is this the peak? It's hard to say. What's more worrying, though, are the projections of a third wave. By most estimates, children could be at risk in the next wave. For more than 2 weeks now, we've been talking about vaccination for children. Now, the Supreme Court of India has raised this. On Thursday, the top court asked the central government to ensure vaccination of children and start preparations to handle the third wave. Do you know how many kids have been infected in India since the pandemic began? Less than 4%. Around 700,000 children up to the age of 10 have been infected by the Wuhan virus. So far, experts have maintained that children are not among the vulnerable population. They're either asymptomatic or they recover after showing mild symptoms. But now the assessment is changing. Look at the United States. It's in the middle of the third wave. The caseload has fallen, yes, but more and more children are getting infected. Let me give you the example of Colorado. Children make up 26% of the new cases there, 26%. More than 800 children between 0 to 19 years have been hospitalized. In the past week, children accounted for 22% of the new cases in the US. 1 year back, they made up only 3% of the new cases. Do you see the surge? From 3% of all cases to 22%. Children are getting infected in larger numbers. The question is why? Experts have given 3 reasons for this. One is vaccination. As more adults get vaccinated, they're better protected. Children are not. Reason number 2, the new variants, they spread faster. They infect larger populations quickly, and that includes children. And reason number 3, the lifting of restrictions on school activities. Elementary and middle schools are reopening in many parts of the world, so children are being more exposed. So what do we do to save the children? Vaccinate them. There's a sudden urgency to do this, and rightly so, across the world. Canada has approved the Pfizer shot for 12 to 15-year-olds. America could soon be the next country to do that. Reports say this age group will be given the same doses as adults. More countries should start planning on these lines, not only to save the children, which itself should be motivation enough, but also to save others, because unvaccinated children could be what they call silent spreaders of the Wuhan virus. A study was published last year in the Journal of Pediatrics. Here is what it found. Children can have a quote-unquote significantly higher level of virus in their airways. What does that mean? It means that kids might not get very sick by an infection, but they can still carry a high viral load. What's a viral load? In simple words, it is how much virus you have in your body. So children could be more contagious than adults. Another study found that children spread the virus more efficiently. Those are the words they used, more efficiently than adults, because they can carry more virus. The study looked into kids younger than 5 years of age, those who were infected and showed mild to moderate symptoms. Researchers found that these kids had 10 to 100 times more virus in their nose and throat than older children and adults. So we need to protect our kids for 2 reasons. 1, because the risk of infection is now high, and 2, because they pose a risk to those around them. The writing is on the wall. It's important to vaccinate children sooner rather than later. Can they get the same shots as us? Yes, they can. Only the dosage will have to be different. As we speak, vaccine makers around the world are testing these shots on children. Companies like Pfizer and Moderna are conducting dosing trials. They're trying to figure out how much vaccine kids can tolerate. And children are not one age bracket, we must know that. Dosage will be different for a 6-month-old, a 6-year-old, and a 16-year-old. And it's important to get this right. We'll be tracking this story very closely. WION is now available in your country. Download the app now and get all the news on the move.